The fall brings a trio of ingredients that could be a recipe for a public health disaster. COVID-19, schools reopening, and flu season. As we face those upcoming challenges, I recently sat down with Beaumont Health Director Sherry Ulmer to see how the city's health department is managing the response to the pandemic. Ulmer says she does have concerns about the next few months, which are scary to think about. And so you've never seen anything like this?
Nothing like this.
Wow.
I've never, ever. The closest we came was H1N1, which was nowhere near this.
Beaumont Health Director Sherry Ulmer is speaking to the reality the city is facing, approaching the fall and still fighting an uphill battle against COVID-19.
Do you feel like the citizens of Beaumont are taking COVID-19 seriously?
I think a lot of them are. You know, personally, I know a lot of them who are. I think some of them may not be. And, well, you know, I guess, Kimberly, I really can't say that. I can say that we see our numbers increasing. And so because of the numbers, I would think that we're not doing something that, that we could be doing to prevent the spread of the virus.
Ulmer says 10 new employees have been hired, and administration even created a command center. Nurses and other personnel can focus on contact tracing, identifying people and places linked to a positive case. That command center even busier because of recent holidays. As feared by health officials, Memorial Day and July 4th proved to be problematic.
We saw that we had plateaued and started a little downward trend prior to Memorial Day. At Memorial Day, things began to partially open. And every public, not just us, but every public health official, I think, across the United States said, this is going to be a problem. And at that point, we can look at the charts. Our numbers of confirmations took a U-turn, and they started to go back up, and they've gone up ever since.
And now with the start of school, Ulmer says we will see more cases.
I do believe that kids should get back to school. That's important. But at this point, is it wise? And so how can we make that happen? Is online school going to be an option, which I know for BISD it is, until we can see our numbers start to come down?
The health department worked with a Lamar University statistician to get this breakdown of the numbers. As of July 22nd, there were 2,337 confirmed cases in the Beaumont area. 300 of those were 18 years old and younger. Additionally, like research from other regions, the numbers showed that minorities were disproportionately affected. 47% of cases were African Americans and 39% were Hispanic.
We know that there's more COVID-19 per capita in the Hispanic population. So we're preparing our Spanish-speaking staff here now to be able to work with that population to get them the education that we feel they need.
A notable challenge in Ulmer's opinion, different messages come from different sources, like politicians and others who are not health experts.
Is there a concern that may lead to public confusion?
Absolutely, yes, absolutely.
And so how do you handle that as health director?
We keep saying the same message, and I want people to, we listen to the medical experts. So that's what we're encouraging people to do, listen to one voice. And if you hear anything that's inconsistent with what the medical community is saying, call us. If you have a question, if you have a concern, if you're confused about it, call that helpline. We can answer your questions.
Ultimately, Ulmer says following CDC guidelines will help us bring our numbers down. Stay home if you're sick, avoid large crowds, and wear a mask.
From a public health perspective, we certainly think that we can always do better.
Another big challenge, Ulmer says, is keeping up with the CDC recommendations since they change as more is learned about the virus. And with those changes, Ulmer knows the public will have questions. The department set up this hotline to call, 654-3616. It's open Monday through Friday from 8 a.m. until 5 p.m. Two nurses will answer any questions you have about COVID-19.